Good afternoon, it's Kris Mastrangelo with Provider Lounge. We're here at the annual American Healthcare Convention. Today we have Brendan Williams from New Hampshire Healthcare. Brendan, thank you for joining us.
Thank you, Kris.
Brendan, I have to tell you, I love your updates. You write the best narratives and give such great information on what's happening in New Hampshire, and you distill and synthesize for the readers.
Right.
Thank you so much for that.
I really appreciate that, Kris. Thank you.
Tell us a little bit about what's happening in New Hampshire and
Right.
what keeps you up at night.
Well, I think the staffing crisis right now keeps me up at night. We really have a red-hot service economy in New Hampshire, 3% unemployment, which is great for the economy as a whole, but challenging when it comes to recruiting and retaining caregivers. The Medicaid rate's only gone up 4.5% over the last 7 years. And when you think about the fact that providers have had to get pay increases over that time, you can imagine how squeezed they are when it comes to finding caregivers and keeping them. So we're really challenged right now.
And coupled with the fact that the requirements of participation are putting a higher expectation on training and competencies, that's going to absolutely impact the operations as well.
It feels as if floggings will continue until morale improves. Unfortunately, the federal government has been really unmindful of the work of long-term care providers. Most people at CMS tend to come from the hospital industry or they come from the insurance industry, and they don't really understand long-term care. So it's a challenge for us. I know that the intentions are good in terms of a lot of these requirements, but it's just an additional burden for all providers.
Agreed. The intentions are good. And I think that, as I spoke earlier, that when we have these requirements and the proposed rule identifies that the complexity of the patients has increased,
Right.
and how can one expect higher standards without reimbursing the providers for that? It threads right into this conversation.
Well, and a lot of these discussions about quality sort of seem like admissions against interest in the sense that it's as if providers aren't already providing good quality. And in New Hampshire, we're second in the nation when it comes to having fewest health deficiencies. So we think we're already doing a good job. Obviously we'd always like to improve, but the idea that this could be driven by federal regulation, not really the case, particularly if there's no funding accompanying that.
Excellent, excellent. And the facilities are beautiful and they are absolutely well run.
Right.
It's amazing. It's beautiful environmentally as well. So one more comment. What about the integration of the 5-star with the quality measures? How are your providers receiving that? Are they just sort of managing it along, or do they have any issues with the 5-star?
Well, I think that they fear that all of this is a bit arbitrary. It's sort of like a lot of what's going on in schools these days, where you're just teaching to the test, right? I mean, there's so much more to the quality that a long-term care facility provides than just these sort of arbitrary measures. And I hope people aren't fooled into thinking that that's all there is. I really hope that they take the time to check out facilities and to get to understand the caregivers and the type of care that's being provided, and not just rely upon these arbitrary measures.
Agreed, 100%. I'm a major patient advocate, although I like the reimbursement aspect of it and the regulatory, and I do believe in my years in hundreds and hundreds of nursing homes that the services provided are underestimated.
Yes.
And I didn't realize that the governmental makeup was of non-skilled experienced individuals. That does put a different spin on it for me. In other words,
Well, yeah, it's really tough for us because, those wanting to go into long-term care are already spending so much time training. And if they have a better option in the service sector somewhere, are they really going to put in that effort in order to become a licensed nurse's aide? We need to make caregiving attractive to this current generation. And we can't have people getting poor taking care of the poor. And that really is what happens in Medicaid facilities, unfortunately.
That's great. Great quote. We can't have people getting poor taking care of the poor. That's going to be the tagline for this one. Thank you so much for coming. Thank you.